Voice is an innovative grants facility that supports rights holders and groups in 10 countries in Asia and Africa facing marginalization and discrimination in their efforts to exert influence in accessing productive resources, social services, and political participation. It aims to amplify and connect the unheard voices with the principle of leaving no one behind. After 5 years of voice implementation in Uganda, we wish to take you on a journey to show the footprints of rights holders that have been working to improve rights holders' access to social services, particularly health and education. However, many vulnerable members of our society are denied access to healthcare services due to several inhibiting factors such as price of services, accessibility challenges, negative community perceptions. Sexual and reproductive health and rights of persons with disabilities has been overlooked by the different actors despite the fact that they are vulnerable to abuse and need these services urgently.
When it came to health services, it was quite challenging. Actually, myself, I was always so fearful to go to hospital to get health services. After hearing what my fellow persons with disability were going through, so when they gave me this project of voice, sexual and reproductive health rights, it was a very, very good eye-opener for me to go out to learn and then go out and teach others. First of all, myself, I learned that I have a right to sex, to marriage, to make a choice of a partner, and to have sex by choice, not by force. So after learning that, we conducted a training for other persons with disability, both male and female, but we found out that more challenges were being faced by women with disability.
For me, before voice came, life was not good. There was a lot of suffering and the situation was really bad. When Voice Project came, they requested us to join, and now see, health has improved, and through hospitals I've been able to get help, and then health has improved. When you go to the hospital, we have the confidence now. We can also speak, we can also try to sign, although they know some small sign language, but at least they can try. Communication at least has continued to come the hospital.
The Uganda National Action for Physical Disability worked to improve access of sexual reproductive health care services among youth and women with disabilities through several advocacy efforts that resulted into several improvements in the lives of youth and women with disabilities.
Persons with disabilities who are most times ignored in line with sexual health, they should be included in all programs of sexual and reproductive health rights for persons with disabilities.
District local government made efforts to increase budgetary allocations for SRH, particularly to make health centers accessible to PWDs and availing friendly healthcare providers. SRH service delivery partners trained their staff and made their services disability friendly. Access to education has often been a challenge among several youths in Uganda, particularly youths with disabilities, resulting into low enrollment, high school dropouts due to unplanned pregnancies, poor primary school completion rates.
Parents had their children, but many of them are single mothers. I myself am a mother. My son is now a lab technician, whom the dad rejected, thinking he was a dense child, but I have a lab technician right now. So that kind of hope I had in my son, and I helped him work out, is the same hope I was like, children with autism will change no matter what the society thinks.
Advocacy through music, or amplifying the voices of persons living with autism through music, it has really done a great change. We have seen some participants living with autism, they have really improved in their communication skills. They have learned how to socialize with one another, since the project enables participants from the community to be part of us. So we socialize, we do different activities, and so we have seen a lot of change.
This thing has been mingled with madness. It's not madness actually. They need to be separated. That's when we can have the program, and we program for them at national level. We look at them as autistic persons, not as mad people.
Sorak Development Agency worked through the Teen to Teens project, used community theatre approaches to raise voices on sexual reproductive health and education, rights of the voiceless young girls and youth with disabilities in Mubende district.
Sorak Development Agency is a proud beneficiary of Voice. Voice supported Sorak from 2018 to 2020 in a project titled Teens to Teens. I think Voice Oxfam could have been captured by the innovative approach we proposed in this project, whereby we wanted to reach right holders, the vulnerable, the voiceless girls, women and children specifically, those ones in hard to reach areas or environment, raising their voices in order to promote their sexual reproductive and rights as well as education rights via participatory theatre.
Twagendanga nga tuyimba nga tusomesa abantu ebintu ebyenjawulo. Twagenda nga tusomesa abantu okusomesa abaana obutaleka abaana bawala mabega oluusi mbu omwana omuwala bw'akula mwalina okufumbirwa nedda ng'ebyo byonna tubiyisa mu nnyimba nga tubibasomesa. Solaka eyongeremu amaanyi etuukemu ebyo ebifo byetatuukangamu kubanga abantu bangi bolaba ku mawulire ng'abaana ddala bambi babafumbisa nga bakyali baana bato, naye singa Solaka enaatuyamba neetuuka mu bifo ebyo ebyeyawala ebyenjawulo abantu bajja kulekeraawo okukaaba. Bwenaatuukayo era ne bakola nga bwe tukoze eno nga bwe batuyambye, ekyo kye twagala.
Our efforts in upholding fundamental human rights to access basic social services have yielded fruits thus far. We must gear up for better outcomes while leaving no one behind.